Systemic sclerosis with the typical features on the hand. The skin is very thin and shiny in appearance. There is a loss of the subcutaneous tissue, and if we pinch the skin, then we can feel there is only epidermis. There is no subcutaneous tissue or mass. The skin is thinned out and it is shiny in appearance, and there is the stretching of the skin, and due to the stretching there are contracture formation because of the palmar thinning of the skin. So these are the flexion at the distal parts of the hand, and these are the flexion contracture due to the skin tightening. And there is syndactyly, the limbs, the fingers are short, and there is also the history of the Raynaud's phenomena. Whenever the skin is exposed to the cold environment or cold water, then it becomes then Raynaud's phenomena occurs, in which first of all the color of the palms, the palmar surface of the distal fingers becomes pale, then it becomes blue, and then and when the blood circulation resumes, it becomes red. So it can be appreciated when the patient presents in the acute state. Now at this moment it cannot be appreciated. There is also the telangiectasia at the face, and sometimes there is a loss of the nails. In this patient there is no as such loss of the nails. We can feel the nodules which are due to the calcium deposition in the patient of the systemic sclerosis, but in this patient nodules are not there. But there is a skin hardening due to the collagen deposition. So this was the typical features of the in the hands of the patient with the systemic sclerosis. Similar features can be appreciated on the foot. There is a thinning of the skin, and there is a loss of the subcutaneous tissue. The skin is very thin, and there is also syndactyly of the fingers. So this was the typical features of the in the limbs of the patient with the systemic sclerosis. If we will ask the patient to close his hand, close her hand, she cannot close her hand due to the contractures. बेटे हाथ बंद करो, हाथ मुट्ठी बंद करो पूरी. So as we can see, she cannot close her hand due to the contracture formation and due to the skin tightening. Similar skin tightening also occurs at the mouth, and due to which the mouth the patient is unable to open the mouth, and there is a loss of the wrinkles on the forehead. And telangiectasia, that are the dilated blood vessels, are also present on the face of the patient. So these and if we examine the nose, that is pinched, and the mouth becomes shorter, and is unable to, the patient is unable to open her mouth. All these features occurs due to the skin tightening and skin thinning. The mouth in this case, condition is typically called the fish mouth appearance. So these are the features we find in the patient with the systemic sclerosis.